Did you know that 20% of all sports injuries will be an ankle sprain? An ankle sprain. Melissa Meiste here from Nephew Physical Therapy, here to talk to you about your ankles. I'm thinking of ankle sprains because pretty much everyone in my family has trashed one or two in their lifetime, or the same one over and over and over again. My right ankle's not really there anymore, and so it can step and just roll on those carpet snakes, if you've heard of those. And so I was thinking about it because we've had a few people come in, but not because they've had a recent ankle sprain, but because it's something that's been bugging them for a couple of years, because they had an old ankle sprain that's now showing up with their ability to play sports, walk, balance, not trip, any of those kind of things. And so what you probably have heard a lot is the importance of RICE after an acute ankle sprain: rest, ice, compression, and elevation. And as I was taught, compression is actually the most important thing. So think about that. You sprain your ankle, you're playing basketball, stepped on somebody's foot, you're playing volleyball, stepped on somebody's foot, or you're playing outfield and the field is not level, which happens a lot, and you've rolled your ankle, or you fell down the steps, or something equally simple. The ankle will start to swell, and the thing that creates the most problems with an ankle swelling is that it eliminates the ability of the ankle to move. It grows, it swells, and then you lose motion, you have more pain, loss of strength, all of that happens. So that's why we want to keep it compressed. That's why you don't take your shoe off right away, okay? Unless you think you broke it, which is a whole other issue. We're talking about just sprains today. So you want to keep it compressed. That's important to do good wrapping. Don't let your toes turn purple. That's not good at all. But keep it compressed, keep it tight, so there's no room for that swelling to go. Now, depending on how serious the ankle sprain is, and as I looked and did a little research online, most people never seek medical attention for an ankle sprain. We think of it as normal. And that's also because it usually gets better pretty quickly. The problem is, if that ankle stays swollen, stays painful, limits your ability to walk normal, and you don't build back your flexibility and strength that you lost, you're at greater risk to sprain it again and or do damage somewhere further up the chain. So we think it's really important for you to manage that initial injury well. Rest, ice, compression, number one, and elevation, which is your foot above your heart. Don't forget that. That's elevation, not just putting it up in the recliner. That doesn't count. But then paying attention, do you need formal physical therapy later? Those are questions to ask yourself. So 1, does it still hurt? 2, do you have full range of motion without pain? And 3, can you walk without a limp? You need all those 3 things before you return to normal sports, activities, yard work, any of that kind of stuff. Those things need to all be in place. And if not, choose physical therapy. I'm telling you, it's one of the fastest rehabs that we do. People are not in therapy for months and months and months, because if we do good hands-on massage therapy, manual therapy, depending on what you want to call it, where we're working on those muscles that get tight and sore, because you'll often irritate the muscle when you sprain that ligament, and then progressively working on strengthening and balance and range of motion in a controlled setting so that you don't go too far too fast, and we get you back to where you want to be. So things to keep in mind when it comes to your ankle, and again, if it's been there a long time, it's never too late for you to get help. This is Melissa Meiste again with Nephew Physical Therapy, making sure that you take care of you.